As we've already heard, there are many reasons why end-of-life planning can be meaningful and helpful for families. But let's be honest, that doesn't mean starting the conversation is easy. Dr. Renee Critchlow knows what can happen when families avoid this topic. She's a family medicine physician who teaches at the University of Minnesota and works at the Broadway Family Medicine Clinic in North Minneapolis. And Renee, you've seen this both inpatient and outpatient. What have you seen and what do people get wrong?
Well, Kent, thank you very much for bringing this conversation to the forefront, because it's really what needs to happen. Too often, these end-of-life conversations, the first times they are discussed is in the hospital. And that's just wrong, because where you really want to have these conversations is when you're surrounded by people that you trust and that you know, and that can hear what your wishes are. So we really recommend people starting these conversations with their family and continuing with their primary care doctor, so that the first time you have this conversation, you're surrounded by people who love you and care about you.
Yeah, you talk about family, and one thing we all know is every family is different, right? Yeah. We also know communities are different, cultures, race, it all comes into play. Religion definitely comes into play. How have you seen that, and what can you bring to people that maybe don't share your background, and how do you do that as a physician?
Well, I feel very lucky in that one of the things that I get to do also is teach. And when I'm teaching younger physicians how to engage in these conversations, I tell them that what we're really looking for is cultural humility. We're learning with every engagement with different cultures. We, at Broadway Family Medicine, about 80% of our patients are African American and 20% are actually Hmong. And it's an interesting confluence of cultures, especially when you talk about end-of-life issues. If you look at the African American community, a lot of problems have occurred engaging with Western medicine. People were experimented on. Everyone knows about the Tuskegee experiments and things like that. Long history of distrust. And so when they enter the medical system and they don't know the physicians that are there, it's quite hard for them to feel that their best interests are being taken under advisement. So one of the things that we say is that it's really helpful for us to have that conversation with our patients, because they know that we have their best interests at heart. They know that we've been there, taking care of their babies, taking care of their grandmas, and when they're having an end-of-life discussion, we're going to be listening to what their wishes are and not treating them like someone who doesn't understand where they're coming from. So it's really about an open, honest, trusting communication.
So many times trust is built internally. It starts with a family member, starts with someone that might be watching right now that wants to bring it up. How do they get that conversation started in their families?
Well, I think one of the big things we have to understand is that culturally there's very different approaches to death. And in the mainstream culture, right now, our biggest thing is ignoring death. And that's really very dangerous, because then the conversations about end of life take place in the most critical times, when people's emotions are at the highest, and what's at greatest risk is increasing someone's suffering as opposed to prolonging their life. But if we have these conversations before we're in the critical stage, we help people start the discussion by saying, you know what, this is what my wishes are. And that's really what it's about. It's about addressing the patient's wishes and having the family understand that when it does come to end of life, they're not pulling the plug, they're not killing grandma, they're fulfilling the wishes of their loved family member. And they're presenting those wishes to people who are caring for them. We want to care for the patient in the most compassionate way possible. And understanding what their wishes are is a very important part of that.
And one of the things that we talked about just before we came on here is talking about the resources that are available. I know them well from the series that we did on Honoring Choices, but you were saying that can really play a role no matter what background you are, because they've taken care of that.
Yeah, and it's about opening the conversation. The Honoring Choices, they have the discussions in 5 different languages, and it's really at least 5. And it's what you're looking at is, how do we start this conversation? And what I would say is that when we're thinking about caring for our loved ones, communication is how we care, and expressing to them what our wishes are and what our values are. And going through the Honoring Choices program can allow you to develop the conversation to the point where you can produce a directive that can be used by you and your family in the future And sharing that with your primary care doctor, I think, is very important because we can become your advocates even when you're unable to speak for yourself.
Communication is how we care. I think that's the perfect advice for anyone trying to undergo these conversations. Thank you, Dr. Critchlow, and we'll be right back.